I'm trained as a health and neuropsychologist, and as the former, I'm interested in how biological, psychological, and social factors interact with and affect our overall wellness. A lot of my work includes exploring the relationship between stress, health beliefs, coping styles, and other psychosocial factors that play into our overall functioning. And under the umbrella of health psychology is pain psychology. And as a pain psychologist, I'm an important part of helping people live with the threat of living with chronic pain. I got into pain psychology because I have my own lived experience with pain. I've seen firsthand how chronic pain can really pervade every aspect of one's life. I also understand what it's like to feel unseen, to feel misunderstood. It took me 24 years to get a diagnosis of endometriosis, and I was told many times that it was all in my head. When a patient comes into my office and has been told that the pain is just in their head, I look at them and I say, I'm here, I see you, I validate you. It's not all in your head, it's a very real experience. It's whatever you tell me you're experiencing. That's exactly right. One of the things that I do as a pain psychologist is help someone parse themselves from their pain. And instead of I am my pain, I am experiencing pain. When I treat pelvic pain, I treat it from a trauma-informed lens. Sometimes patients with pelvic pain have a history of sexual abuse, and that needs to be taken in the highest regard. For me, the first marker of healing is the patient truly understanding that this is not a black or white experience. It's not I have all the pain or I have no pain and that's the answer. And when they can grasp that, when they can understand that even increments of relief are to be validated and to be celebrated, that's when the true healing starts to happen. Chronic pain is one of the biggest public health problems in the United States, so much so that the American Academy of Pain Medicine reports that chronic pain affects more Americans than diabetes, heart disease, and cancer combined. Part of the challenge is that so much is still unknown and uncertain about chronic pain mechanisms. Acute pain is fathomable, it has a purpose. When we stub our toe or touch a hot stove, the pain we feel alerts us to the fact that something needs tending to. Chronic pain is pain that stops being adaptive, and instead of being a privilege, it lingers and disables. So much is unknown, but what is now known and widely accepted is that pain is a multidimensional experience that lingers in the context of our individuality, including our temperament, mental state, personality style, cultural context, and socioeconomic status, just to name a few variables. The pain signal impacts upon pain perception, but so do emotions, thoughts, behaviors, and social responses. Psychologists working with chronic pain patients are not trying to see whether pain is real or imaginary. All pain is real to the sufferer. Since pain is a multidimensional experience, pain doesn't just affect the body. It also affects how much you can do, how you feel emotionally. There may be losses as a result of pain. Job, finances, self-esteem, confidence. Thinking patterns can change, become negative, low, and full of frustration. Tempers can become short and memory and concentration poor as a result of long-term pain, all of which can affect mood. In fact, depression is the most prevalent disorder occurring with chronic pain.